So, good morning, everyone. So today is our third lesson about how we look at organs in traditional Chinese medicine. I'm Yang, the acupuncturist and herbalist from the Central Balance. So first, today, I would like to talk about the lung from the perspective of Chinese medicine. In Western medicine, we all know the lung is mainly responsible for breathing and gas exchange. However, in Chinese medicine, the lung has much broader role in regulating the whole body. So which means in Chinese medicine, the lung has more functions than we think. So it governs breathing, body fluids, immunity, skin health, and even emotional balance. And one more thing, your stool movement. So at first, I would like to talk about the location and structure of the lung. In traditional Chinese medicine, the lungs are located in the chest cavity, with one on the left and one on the right, covering the heart from above. They are divided into loops, and their structures is described in classical texts are empty like a honeycomb. So, of course, we know in Western medicine, the lung can divide it into 5 loops. The left is 2, the right is 3. Okay, and why they say the lung organ is empty like a honeycomb? That's because inside the lung there are a lot of cavity. Because as we all know, the air through the trachea, through the bronchi into your lung, right? And there are a lot of small cavity inside a lung. That's how the oxygen around these cavities in the lung, there are a lot of vessels around there. And when the right heart ventricle pump the blood into the lung, and those blood circulate around these cavities in the lung, the CO2 release from the blood to the cavity, and oxygen into the blood, and then all this blood um, go to the right heart, which is the right heart atrium, and to the right heart ventricle, and pump to the whole body. That's the circulation of the lung. The circulation of the lung. So because we need the lung to exchange the oxygen and the CO2, so that's why they must be empty like a honeycomb. That's how it works. So this discrimination emphasizes the lung are light, delicate, and full of air spaces because it's function. So, sometimes the function dominates the anatomy. Of course, the anatomy will make this organ has a special function. It's all related. So the lung system includes the airways such as trachea, bronchi, which connects to the throat and the nose. Of course, we all know your nose, your throat, your trachea in here uh, connected to your lung. That's the respiratory system. Therefore, the throat is considered as the gateway of the lung, and the nose is the external opening of the lung. So, as our PPT said, the lung connects deeply with the throat and nose, influencing the respiration and the sensory functions. The lung is an internal-external paired with the large intestine, forming a critical energetic connection. Its associate element is mental, embodying piercing, precision, purity, and structure. Okay. We talked about this. We talked. We already talked about this before. The lung as the canopy. In TCM, the lung is often referred as a canopy due to its elevated position with the body, symbolically sheltering the other internal organs. So it's very easy to understand. The canopy is like a very expensive umbrella. In why the Chinese medicine use the canopy to describe the lung, because there's a story in traditional China, in ancient China, when the emperor of the whole empire, when they go out, when the emperor go out, so his chancellors, his servants must use the canopy to cover the emperor's head. It's like an umbrella to prevent the rain. But on the other hand, it's more like a symbol. It's more like a symbol of the power. So canopy of the emperor is more like uh, the symbol of the power in ancient China. So because the lung's position, as you can see, we have 5 organs in your body, right? The lung, the heart, the spleen, the kidney, and the liver. But the lung is on the top of the other 4 organs. This is like canopy of the whole body. That's why in Chinese medicine we describe the lung as a canopy, because high position and external pathogen defense and water metabolism governor. Okay. So yeah, the canopy was originally the roof of covering the emperor's carriage. Yeah, a covering of the emperor. So best spread by spreading defensive energy to the body surface, the lung protects the internal organs from external pathogens. The lung also governs water metabolism and it is called the upper source of water. So, so what's that mean? By spreading this defensive energy to the whole body, to the body surface, is because in Chinese medicine, we believe the lung can regulate the qi, the energy. In your body, we have a different kinds of energy, and one kind of energy is your defensive energy. In Western medicine, it's easy to understand your immune system. Your immune system. In Chinese medicine, we believe the lung controls the protective energy in your body, which is your immune system. So that's because the lung has the function of protecting your body. The lung, oh yeah, okay. The lung, a fragile, a fragile organ. The lung is described as a delicate organ in traditional Chinese medicine. This means it is sensitive and easily affected by colds, by heart, dryness, and external pathogens. The lung communication directly with the outside world through breathing and skin. Therefore, external pathogens often attack the lung first. So when treating lung disorders, Chinese medicine prefer gentle, light, and dispersing method. Excessively cold, hot, or drying treatment are usually avoided. Let me explain to you. So in Chinese medicine, we believe that the lung is a fragile organ. It's very easy to understand because in Western medicine, because the lung connected to the outside, right, to the outside world. Every day you need to breathe. You need to breathe the air, breathe in, breathe out, breathe in, breathe out. So the air comes through your nose, your throat, your trachea, your bronchi into your lung, right? And sometimes, if you are in a very bad environment, like you in a hospital or in some epidemic area, you know, a lot of disease, virus comes through your respiratory system into your lung. We all know about the SARS, the COVID-19. A lot of epidemic um, epidemic disease. The first organ they attacked is the lung. That's because the lung, exposed to the outside world, connected to the outside world, so the virus can easily going through to your body. So why other organs cannot be affected easily? Because other organs is in your body. They are not they are they don't connect. They don't connect to the outside world. Only only two organs except only the lung, the large intestine. Sorry, only along the stomach they can connect it to the outside world because the lung the lung connects the outside world through the respiratory system. You know, you breathe in, breath out. A stomach can also connect it to the outside world because you eat things, right? You eat the food, the water, this through your body. So that's why the lung is fragile. And in Chinese medicine, we also believe um, we believe the lung communicates the outside world through the skin as well. So, what does that mean? The lung connects the outside world through your skin because you know in our human body, in our on our skin, there are a lot of small holes in your skin. So especially when you're sweating, the holes on the skin will getting bigger, right? Because the holes on your skin getting bigger, the sweat come out. So you know a lot of people like running when it's raining or it's windy. That's very bad actually. Because when you exercise outside, you you're sweating a lot sometimes, right? Especially you run a long journey. Especially run a long journey, you're sweating a lot. The holes on your skin are bigger, open bigger than you are quiet, right? So exactly at that time, the virus, the bad things can invade your body through the holes on your skin, and it cause the disease. So that's why some people, when they 14, 15 years old, they have arthritis, they have the pain on their muscles. That's because some people they running in a rainy day or in a windy day. Um, the bad virus, bad germs, or the bad things invade your body through the skin during your exercise. So, because in Chinese medicine, we also believe the lung connected to the skin. So sometimes Chinese medicine believe, um, uh, some Chinese medicine believe um, the the pathogens invade your body through the skin and attack the lung. So it's not easy to understand. I just give you an example. You must have heard of the lung infection. You know the lung infection, like a lung infection by germs. Some young people, right, after they drunk in the night, or you know, or the outside, they are outside with a heavy rain. They get cold in a rainy day, especially when the rain on their body. They are not using an umbrella, or they are drunk a lot, and sleep outside the house. So they got the lung infection. That's because in Chinese medicine we believe the pathogens invade your body, especially through your skin, and attack your lung. It causes your lung infection. This Chinese medicine. Okay. So that said, when treating the treatment for lung, especially emphasize gentle dispersing and moistening herbs to restore harmony. What does that mean? It means when we treat lung disease, we prefer to use some gentle or um, not so aggressive method to treat lung because as we said before, the lung is fragile. If you use some um, very aggressive, intense herbs to the lung, it will cause injury of the lung. Okay, lung energy, lung qi. ascending and descending. What does that mean? One of the core physical psychological feature, one of the core psychological features of the lung is the movement of the lung energy. The lung energy moves in two opposite but complementary directions. Depression refers to the upward and outward movement. Descent refers to the downward and inward movement. When the dispersion and descent are coordinated, breathing and flood, blessing and fluid, metabolism remain normal. So it's hard to understand. Chinese medicine believe the lungs function, no matter the breath function or the fluid metabolism function, are all relied on the lung energy movement. The lung energy movement has two directions, uprising and downward. It's just how the lung energy movement in the body. A normal movement of lung energy should be ascending and descending. Okay, let's let's explain it. Okay, lung energy ascending helps expel bad air from the body, which means it's like your breath out, is your breath out, breath in, breath out. Breath out is like ascending, the breath out, the lung energy push the CO2, push the stale air out of the body as one function. Push out the CO2 out of the body. Second, it distributes fluid and nutrition to the skin, to the head, to the body surface. Oh, some people will confuse that. Oh my God, I just know the lung is connected with the breast. But what do you mean the lung can transport the nutrition and the fluid to the skin, to the head, to the body surface? That's because in Chinese medicine, we believe the lung energy ascending, it can push the nutrition outside. It can push the nutrition to the surface, to the skin, to your head, because ascending, the energy, the lung energy, uprising, upward, spread, diffusion. It's like you irrigate your plant. You can imagine when you use the water pipe, right, to irrigate your plant. It's like whole long energy ascending movement. So, and third, it also spreads defensive energy to regulate sweating and protects the body. So the protecting energy in Chinese medicine is Wei Qi, also known as the defensive energy, protecting energy, defensive energy. So we believe the lung energy ascending also can also do other things. It can also to spread the defensive energy to the surface of the body, regulate the sweating, and protect the body. So which means in Chinese medicine, the immune system can work well, also rely on the lung energy ascending. You just remember that. So If the lung energy feels too depressed, symptoms such as chest tightness, coughing, nasal congestion, and lack of sweating may appear. So of course, if something wrong with the movement of lung energy, if the ascending if the lung cannot ascend, it will cause chest tightness because the bad air cannot push out. It can cause cough and can cause nasal congestion and lack of sweating. So when we treat a cough, the nose, runny nose, nasal congestion, or a person cannot sweat, we always use treat the lung to treat the lung. That's because these symptoms caused by the disorder of the lung energy movement. Next, so the lung energy descending, receiving, and consolidating. The lung energy descent allows fresh air to be inhaled and sent downward to support the kidneys. It also directs body fluids downward to form the urine. In addition, it helps to clean the airways clean. If the lung energy fails to descend, shortness of breath, wheezing, and phlegm may occur. Okay, let's explain it, okay? So the lung energy can descend, allows the fresh air to be inhaled, and also it sends the energy downward to support your kidney. So in Chinese medicine, we believe your body has energy. Some energy stores in your kidney. Some energy are generated by the lung and the spleen. The lung can generate the energy. It because the lung can breathe in, can let the fresh air in your body, and it can send this energy to the warehouse, which is the kidney. Let the kidney to store the energy, to store the generate energy. So that's first thing. So and second, it can direct the body fluids downwards to form the urine. So like we speak before, the lung can also regulate the fluid in your body. It can transport this fluid to the kidney to form the urine. It's quite different with Western anatomy, right? And also it can help to keep the airways clean, right? So if the lung energy feels descent, like these symptoms, shortness of breath, wheezing, and phlegm may occur. So that's because the short of breath, because if the lung energy cannot descend to the kidney, it will cause you cannot breathe in deeply. So it will cause the patient will feel shortness of breath, wheezing. So the coordination of ascending and descending energy is very important. Ascending and descending oppose each other but also support each other. When they are balanced, breathing is smooth, and fluids are properly distributed. When they are both disturbed, respiratory and fluid metabolism disorders can occur simultaneously. Although lung energy moves in all directions, its primary tendency is downward and cleansing. So it's very important the coordination of the ascending and descending of energy. If they are balanced, your breath is smooth, right? The transport of the fluids in your body can be, can be properly distributed. So if something wrong with the descending and ascending of the energy in the lung, a lot of symptoms may occur. Yin and yang balance of the lung. The lung yin energy provides cooling, moistening, and support descent. The lung yang energy provides warmth and supports dispersion. If the lung yin energy is deficiency, dryness, internal heat, and coughing with breath reversal may occur. If the lung yang energy is weak, cold and fluid accumulation in the lung may occur, may cause coughing, and wheezing. What does that mean? Because we talked about the lung energy movement before, right? But lung energy, the energy in lung can also divide it into two directions, which is the yin energy and yang energy. So how the descent of the lung energy works is because it is supported by the lung yin energy. How the ascend movement occur, it relies on the yang energy. So it's just explain the lungs function and the lung energy in a more specific way. So we know when the yin energy is differentiate, it will cause heat because yin energy, yin material can cool your body, yeah, can descend of the lung. So if the yang energy is weak, because yang energy is warm, it's hot, it's warm, it can remove the cold from the body. If the yang energy is weak, the cold and the fluid will accumulate in the lung. And if the cold and the fluid accumulate in the lung, it will cause coughing and wheezing. That's why, let me explain. Let me give you an example. If the cold accumulates in the lung, the fluid accumulates in the lung, it will cause a disease named asthma. As we all know, the asthma can only be controlled but cannot be cured, right? Asthma patients always rely on the inhaled steroid, which is the ICS or the pills, because in Western medicine, scientists still cannot find a definite cause of the asthma. They believe something wrong with the immune system, cause allergy, cause inflammation, but it couldn't find defect evidence cause. It's just a suspect. The immune system inflammation may cause asthma. But in Chinese medicine, we believe the asthma caused just by the cold, the fluid accumulation in the lung. Because these cold fluid accumulate in the lung, flame in the lung, and especially when the asthma patient get cold or got allergy, it will trigger the cold, and the allergy is like a trigger of the asthma, right? It will make these enemies in your own body, this cold, this fluid, this enemy inside your body, work together with the enemy outside. Together, it will cause attack of the asthma. That's how the Chinese medicine will perspective of asthma. So, in a simple way, it is the yin and yang is not coordinated. Okay, so is the final PPT about this course. The lung prefers moisture and dislike dryness. What does that mean? And the lung corresponded to autumn, a season dominated by dryness. The dryness easily damages the lung. Common symptoms include dry throat, dry nose, and dry cough with little flame. Therefore, treatment and health preservation focus on moistening the lung. So the lung prefer moisture than dryness. What does that mean? Because you guys maybe many of you guys work in hospital before. I used to work in hospital. When we use the ventilation machine, ventilation machine can pump the air to the patient's lung, right? To help those patients with respiratory failure. We always need to add water when we use the ventilation machine. Otherwise, if you don't use water, if you don't put water in the ventilation machine, the air pumped by the ventilation machine will be very dry. It will injure the airway of the patient. So in here, because every day, when a normal person is breathing in, breath out, you cannot see. Our nose is like it can add water to the air and let this moisture air into your lung. So your nose is like the machine can add water to the air you breathe in and to protect the lung. If the air is very dry, especially in the autumn or in those especially you live in a very hot area like desert area, like dry area, you will feel when you breathe in the dry air to your lung, you feel painful at sometimes, and sometimes because too dry, it will cause your nose bleeding, and it will cause a dry throat sore, and it will cause even cough. And in Chinese medicine, we believe the lung prefers moisture more than dryness. So I give you so many examples so you can understand why. Imagine you breathe in the dry air by yourself, you will feel dry throat, dry dry nose, and feel painful, feel uncomfortable, right? That's because that's your lung. It loves moisture more than dryness. So when we treat the lung disease, we always need to consider about that. Consider about the lung habit, right? So when we use Chinese medicine for the lung disease patient, we like use some herbs can bring more water to the lung. So if you are in your home, you want maintenance your lung, like you want to make your lung health. You can try some pear, the fruit, the pear. You can steam the pear and eat it, and it is very good for your lung. And yeah, okay. So today we talk about some knowledge of the lung in Chinese medicine. Uh, so the next course we gonna talk about more knowledge about lung to your guys. Okay, so see you next time. Have a good day. Bye.